Assalamu alaikum and welcome to Health is Wealth. Medicines play an integral role in healthcare. It is important that you take your medication as prescribed so you get the best results from your treatment. During the long fasts, it may be a challenge to take your medication as prescribed. In today's episode, we will be discussing how you can get the most out of your medication during Ramadan. In the studio today, we have Ashraf Zaman, who is a community pharmacist at Greenlight Pharmacy. Assalamu alaikum, Ashraf.
Wa salam wa rahmatullah.
So, what issues can we be faced with if we fail to take our medication?
Well, simply, you will fall ill.
Okay.
Your condition will probably deteriorate, and it's just probably going to get worse and worse. And it obviously depends on the type of condition and the type of medication you're taking, and how stable your condition is, or unstable in this case. The key thing to bear in mind is, every person, every patient is different. They have different conditions. They may have the same condition, but they may be on different drugs.
Right.
So again, that's something very important to bear in mind.
Medicines in Ramadan. Can you shed some light on how patients can actually take their medicines during Ramadan? Because the fasts are really long. Some patients are taking medication 3 times a day, 4 times a day. So what's your advice?
Okay, so one of the things, Ramadan, again, I'll go back, I think there's lack of education, understanding about medication, and not just necessarily from patients. I mean, the other problem we have is amongst the ulama class, or the scholarly kind of class, the Islamic scholars, who probably, personally, my interactions, they all themselves don't have much kind of information around medicine and just healthcare and during Ramadan and fasting. So it kind of works both ways. We have patients who go and visit their scholars, the people they go to usually for fiqh questions, they go to them. So it's important for us as healthcare, as pharmacists, to really understand this little area, and that also includes the scholars. So we do need to kind of provide them with the correct information. In regards patients, studies have shown, and in fact this is just generally speaking, you have across in the UK or in the Western world, there's stats around a third to up to a half of patients just generally don't stick to their medication as prescribed. And that's just across the board. I'm not talking about Ramadan. This is just across the board, this is what's happening. When we talk about Ramadan, there's been a specific study done in Tower Hamlets in London, where by St. Bart's Trust, and they found that around 24% of patients, and we're talking about Tower Hamlets, which is very kind of populated by Bangladeshi Muslims, and to some extent Somalians as well. Up to 24% of patients are not taking their medication at all during Ramadan.
Not even in suhoor or iftar? Just completely stop it?
Just completely stop it.
Really?
And in my interaction, I've come across quite a few over the years. Yeah. And it's true. It's amazing how, and I'm not just talking about, again, your people with long-term medical conditions and the elderly. I'm talking about generally across the board. So you have that up to 24%. Then you have around 40 to 44% of patients, what they do is they take their lunchtime dose.
Yeah.
They take that with their evening dose.
So they're doubling up?
Doubling up in iftar. There's a massive risk of overdose. Yeah. And again, it depends, because certain things could be fine. But in other instances, no, it could be that it's a serious overdose.
Absolutely. So what's your advice then?
My advice is, well, first and foremost, I mean, Ramadan, people put so much emphasis on preparing spiritually for the month. But they forget that physically we need to have the stamina and be in a physical well-being.
Yeah, absolutely. To endure it,
endure the whole month of Ramadan.
Absolutely.
So people really, they forget about the physical side of things and how much it can take out of you. So really, it's about planning ahead. It's about planning ahead, and that requires seeing your pharmacist. Yeah. Really seeing your pharmacist was, the pharmacist is the one who deals with your medication generally.
Absolutely. The pharmacists are experts in medicine.
They're experts in your medicines. Yeah. They're there, very accessible, long hours. You go, have a discussion, they're free, they're available.
What kind of options are available then?
In terms of options, in terms of options, I mean, there's actually quite a few, and people are surprised, you know, when I do mention, look, to start off with, I mean, there's different formulations.
Right.
Not every formulation, medication-wise, is prohibited from use during whilst the person is in state of fasting. So we have, generally speaking, tablets is well known. Tablets, oral medication will break your fast.
Yeah.
That's pretty standard. It's agreed upon amongst the scholars, traditional, classical, and contemporary. But we have other types of, you know, those same medication can be available in other forms.
Yeah. So you've got like the longer release preparations.
Well, that's one. We've got that, but even before that, with oral medication, you've got medication not, restricted to some extent. You've got patches, you've got injections,
Yeah.
you have, you know, topical creams and ointments, which is all fine. Injections fine, eye drops, ear drops. There's a whole host of different formulations of medicine.
With injections, but I think it depends on
It depends again.
the school of thought, doesn't it?
In the case of injection, to be honest with you, from my interactions and my research and my interaction with scholars, in regards to injection, actually, there is an ijma consensus that injection is fine. So injection, eye drops, ear drops, cream, ointment. Where there is ikhtilaf or difference of opinion is with nasal spray,
Right, yes.
with inhalers.
Yes.
Generally, majority say it isn't allowed.
Right.
Why? So there is differences, but certain things is well known. So insulin, for instance, is a big thing. Insulin is, according to majority of the mazahib, the schools of thought, is fine. Getting a blood test done.
Yeah.
So it's important to know what's allowed and what's not during in a state of fasting.
Absolutely.
But also, I mean, obviously not every medicine, every drug that we have, there's an equivalent form in patches or injections or creams, ointment. But what we do have, even amongst tablet forms, you know, we have medication which works over a long period of time. So classic example, paracetamol. Generally, we say paracetamol, you can take it up to 4 times a day,
Yeah.
and between 4 to 6 hours. There's a reason why, because paracetamol, you know, the effect of paracetamol goes after 3-4 hours.
Yes.
So that's why you may need a second dose.
Absolutely.
So in this case, you can take it up to 4 times a day. But so the drug in your system is working for a particular period of time. But then we have drugs across the spectrum where they work, you know, again, every drug, they have what's known as a half-life.
Yeah.
A kind of chemical term, but it's just different drugs in the body.
The breakdown at
The
different
breakdown
rates.
at
Yeah.
different rates. So it's metabolized in over a period of time. So it depends again on what drug we're referring to, or kind of medical condition. So in this case, with diabetes as an example, we have medication where known as modified release, or just generally with drugs, really, we have
Modified release means it's slow, you just take it once and it slowly releases throughout the day.
Slowly throughout the day,
Yeah.
as opposed to taking it 3 times a day.
So you could take it at suhoor, say, for example.
Take it, well, you can take it at iftar,
Okay.
iftar, and then you could probably take it at, if it's there are drugs where 3-4 times a day.
Yeah.
You could cut it down to twice a day. You could cut it down to once a day.
But not yourself, obviously,
Not
by
yourself,
advice of the
absolutely,
pharmacist. Yeah.
with the advice of the pharmacist, who in turn would, if there's a need, will liaise with the doctor as well to get this information out to the doctors.
Yeah.
In fact, a lot of the time in my practice, we have doctors, you know, sending patients down to us,
Asking for your opinion.
asking for our opinion.
Yeah.
So this is how it is. So there are drugs which work over a period of time, and really the way it works out, it's pretty good for us. Maybe you could argue over the summer periods, the kind of gap between iftar and suhoor, we're talking about 5 hours.
It's quite short.
Quite short.
Yeah.
Maybe, you know, when there's a bigger gap between, it's not too bad. But to be fair, even in our current times, in the summer period, Ramadan, in the summer months, there are still drugs which still does the job, and you can still, that 5-hour window is enough to take 2 doses. Antibiotics, again, there are many classic, you know, there's loads of antibiotics where you can take it over a period of 3-4 times dosing.
That's great.
But then we can have equivalent similar drugs for similar conditions, for infections, and you can take it a couple of times a day.
Yeah. So there's lots of options.
Options available. I mean, that's all it is. I'm not saying it may not be. I'm not saying that, you know, you're going to have it for every condition, there'll be an option available. It's just, or there'll be a particular kind of drug which will do the job. No, there are times, we have to be realistic, there are times where it may not be possible to fast. Someone who comes down with a severe infection will need a particular type of antibiotic. It could be 3-4 times a day, and they just have to stick to it. So it could be that a whole week goes.
Yeah.
But then there are other times there's options. So it's all about the options, knowing what's out there, and really going and seeing your pharmacist.
Yeah.
It's pretty simple.
That's the take-home message today.
That's the take-home message. You go and see your pharmacist. Yeah. You discuss it, and
come up with an agreed plan. Yeah.
Agreed plan. It's all about coming together. Really, it's not a one-way thing. It's coming together. Going back to just insulin. Insulin, you have again. It's the insulin. There's different types of insulin available. Yeah. Some which work straight away. You just literally is having an impact on the body within the first hour or so. But others work throughout the day. So again, there's all of that information.
There's lots of options.
Yeah.
Well, thank you very much for joining us today, Ashraf, and your advice has been very, very valuable. So jazakallah khair. Pharmacists are experts in medicines, so please do consult your pharmacist if you are taking medicines, especially during Ramadan. We hope you enjoyed the show today, and we hope you took a lot of advice and information from this as well. Now it's time for our fitness segment with our personal trainer. Assalamu alaikum.
Assalamu alaikum wa rahmatullahi wa barakatuh. Today we're talking about kyphosis. Kyphosis, or hunchback, is when you've got a curvature of your upper spine. So you might see it in some people when they start curving it to the front. So you can see I've got a bit of an arch in my upper back. Some have a bigger one, some have a small one. And it depends entirely of how long you've left it untreated. The thing about kyphosis is that you can improve your posture and you can improve the muscles in your upper back by strengthening them into keeping your shoulders up and back. That's the exercise that I'm going to show you today. It's a very, very simple, low impact exercise that you can do anywhere. However, I do suggest you do it on a chair. You can do it on a stool-like chair or on a regular chair. That's entirely up to you. You just sit quite comfortably on the chair, put your arms down your side. Try as much as you can to keep your back in an upright position. You're allowed to have a small curvature in your lower back. In fact, I'd recommend it. You're going to take your thumbs and point them outwards in each direction, out from your body. And as you do so, you're also going to try and get them to meet behind your back. Now, unless you're really flexible, you can't actually make your thumbs meet behind your back. But the aim here is to try and imagine that your thumbs have to meet. When you do this, you're using the muscles in your upper back and you're contracting them and strengthening them in this exercise. And by doing so, you're going to ask your shoulder blades to go back and get into the right position.